Autism spectrum disorders are any of the pervasive developmental disorders as defined by the most recent edition of the DSM manual, including autistic disorder, Asperger's disorder, and pervasive developmental disorder, not otherwise specified. And last year, Connecticut made a breakthrough with the passage of a bill providing for mandated coverage of physical therapy, occupational therapy, and speech therapy for the treatment of autism spectrum disorders, but only to the extent such services are a covered benefit for other diseases and conditions under the policy. This year's proposal in Senate Bill 301 goes much further. It would mandate the coverage of physician-prescribed diagnostic assessments for ASDs. These diagnoses, ordered by the child's primary care physician and usually administered by a pediatric neurologist or developmental pediatrician, are often very expensive and can run in cost from $1,500 to $5,000. And currently, parents are forced to pay out of pocket for this. And the standard of care in this field is applied behavioral analysis, ABA, and our bill would mandate coverage for this critical, proven, physician-recommended and prescribed therapy as well. And so we're looking to move forward on what we began last year. A number of other states have already moved in this direction. I believe there are 7 states that provide full coverage of the kind that we're looking to do here. And it is my great pleasure now to introduce the Speaker of the House, Chris Donovan.
Thank you, Mark. Healthcare is, I believe, is a right for everyone. And that right means everything. And it's very important, as we have learned more and more about individuals living with autism, how healthcare and insurance interacts with their needs. And the proposal we have here is a simple one, is that individuals who have insurance should have coverage for the disorders that they need help. These are disorders that are prescribed by their physician, that are proven therapies, and have shown that early intervention, and with these therapies, with these diagnoses, can have long-lasting positive effects and improve the quality of life, not only for the individuals, but actually reduce the strain on further therapies in the future. It just makes a lot of sense. And so I want to thank the advocates, the families, the legislators who have worked so hard on this. Certainly autism is an issue that families have dealt with for many, many years. But maybe we in the General Assembly or in government or in the insurance departments and in companies are slow to catch on. But we are catching on. We understand the needs. And this proposal is very, very important. I will work hard with my colleagues to see its passage. Thank you.
Thank you.
I have a very ill grandson, Joseph, who's 12. His condition is beyond autism. But when I see the care that is given to him 24 hours a day by his father and his mother, it just speaks to how we should do everything possible to make life easier for the parents and those who have this particular disorder. It's growing, as you will hear, at an alarming rate. We have a responsibility to address this, and I'm just honored that I could play a role in making life easier for people. Thank you.
This is a relatively straightforward issue from my perspective. I'm here to support effective intervention, and I'm also here to support science. And the intersection of effective intervention and science in the world of autism is one of the most critical, pressing needs we face, because it is at the center of change. It's at the center of early intervention success. It's at the center of adult service delivery success. And most importantly, it is the cornerstone of allowing a population of individuals who for decades have been marginalized to be fully incorporated into communities, not only to be properly served, but to be your neighbors.
Families living with autism have insurance. We pay insurance premiums. The only reason we are not getting what we are paying for is one word, and that's discrimination. Autism Speaks is going state by state to end this discrimination. In 2008, many states passed legislation mandating insurance coverage. This year, over 30 states, including Connecticut, are proposing autism insurance reform to their legislatures. Connecticut's time is here. It is time to look at the evidence, dispel the myths, and give our families what they pay for, what every other family paying premiums gets, insurance coverage. Thank you very much. Thank you to Senator Looney and Speaker Donovan and Senator Crisco for all of your support.
It's been said, if you've seen one child with autism, you've seen one child with autism. For those of us that have friends, family, coworkers with a child, spouse, or even parent with autism, you know exactly what this means. It means not one of us presents the same, but we all do need help. This bill being presented today means a lot for families like mine. When my family began our journey into the autism spectrum, we were lost, dumbfounded, and most of all scared. First was my son Daniel, who is now nearly 5. He, like so many, just never spoke. He had terrible tantrums. He didn't have any concept of right or wrong. We only got his diagnosis at 3, and while this is well advanced of so many others, I still feel like I should have seen it sooner. In the coming year, we found out about applied behavior analysis and a host of other methods to teach children on the autism spectrum. Luckily, he ended up in a classroom with a board-certified assistant behavior analyst and started an ABA-style program. Even so, we sought out a more credentialed individual to evaluate and recommend how many hours of instruction he needed. I scoured everywhere I could. I kept finding roadblocks. I was quoted anywhere from $500 to $3,000 for an evaluation. Along with those state price tags were months of waiting to get an evaluation. I finally caught a break and found a developmental pediatrician that was accepted by our insurance. And we went to see her, but at that point, my son had already turned 4 years old. At the same time we were struggling with this, we discovered his little brother Stephen was also barely speaking. He didn't tantrum, but like others, he stemmed, spinning round and around and around all day long. He flapped his hands when he got excited, just everything. Having learned from Daniel, we knew what the next step was. We got both of their evaluations, and we were told for Daniel he needed a minimum of 25 hours of instruction time. For Stephen, 20 hours. What they were getting at school was appropriate, so it was up to us to get the rest. But we only live on one paycheck. I stay at home with both the boys, so we really could not make up the difference financially. We have through DCF Services a board-certified behavior analyst that comes once a week for a couple of hours. We would have to pay $125 an hour for her privately. Supplementing what they get from school, that would be over $1,200 a week. It's not unusual for families to spend out of pocket over $50,000 a year for ABA. In addition, I was diagnosed on the spectrum. I was diagnosed earlier last year with autism or Asperger's syndrome. Because insurance policies I have chosen not to use this diagnosis medically. I'm fearful of my medication not being covered. It would at least double what I spend now in healthcare per month. And without my medication, I wouldn't be able to stand up in front of you all today, even as nervous as I am. So for these reasons, my family has decided to move out of state. We're going down to Texas, where our insurance would cover all of these things. Luckily, my family lives down there, so I'm not leaving everything behind, though we are leaving my husband's family here. But the longer we wait, the more time we lose. Thank you, and thank you for sponsoring the bill.